As paramedics, one of the biggest ones that we run into are language barriers, right? How are you going to deal with somebody that doesn't speak the language that you speak?
There's a language line.
Oh, do all departments carry the language line?
Probably not.
Good one.
Do you have Google Translate?
Yes.
Oh.
Yes, Google Translate's amazing, right? So Google Translate's awesome, but let's just say you got bloody gloves, you can't use your phone, you can't.
Double close.
Okay, Google.
No internet service, yeah. So what are you gonna do if you have somebody with a language barrier that you're having a hard time communicating?
Charades.
Hand signals, yeah.
Hand signals, right? Hand signals, charades, right? Does everybody understand ouch?
Yes.
Yeah? Crying, all that kind of stuff.
The Lord?
So, gone are the days of having the little flip charts. You guys don't even know what flip charts are, I'm sure. So we used to have little flip charts that had like 10 to 12 different Spanish sentences. They told you how to basically ask, where do you hurt? How bad does it hurt? What do you need? Yada, yada, yada. There were about 10 of them on there. Super helpful, but now it's gone to electronic stuff, and so now everybody has Google Translate and stuff like that that's available to them. What do you do if somebody says they're dying in front of you and they say, I don't want IVs? They're dying right here, right now in front of you, and they're like,
Do you wait till they go?
My religious
Wait till they
belief
die.
that I do not want anything infused into me.
Are they ANO by 4?
Yes.
Do you wait
They
till
are
they?
dying in front of you.
Are they?
Yeah, you don't give them anything.
They are an adult.
You wait till they go unresponsive, and then it's implied consent.
But they just told you,
They have no consent.
Wait, are they still having a language barrier?
no, we're.
They had a language barrier. They learned it. And now they're dying.
Err on the side of Google Translate.
Yeah. Err on the side, I don't understand what just happened, right?
I think you said you wanted it.
All right, so they are alert and oriented times 4, and they say, I do not want IVs, yeah, it's my religious belief that I don't have anything infused into me.
How do you
If
feel
we
about
don't, you're
it?
gonna die. Is that what you want?
What?
If we don't, you're gonna die. Is that what you want?
I'm okay with dying.
Okay.
Sweet. Have a great day.
Yes, sign quick.
How do you feel about
Yeah?
it?
Take them to the hospital.
Everybody's just like, yeah, cool. Yeah, cool.
As the bus is coming.
Yeah, you hear the beep, beep, beep. Hear that bus coming for you, Andrew? Because you're cool, you agreed with them. So they go unconscious now because they have a systolic blood pressure of 60 over 40.
Now it's implied
Now
consent.
what?
They were ANO by 4 when they gave their wishes.
Okay. So what are you gonna do, dude?
Not for
So-
them.
Transport them?
So people who have do not resuscitate DNRs have to have paperwork that we can find,
Right.
right?
Because they're unconscious and
unconscious
can't make that
when you
decision
see
for
them.
them.
Oh, yeah.
If someone tells you, I do not want a breathing tube put down my throat, as they're struggling to breathe, because we specifically will ask patients, severe COPD patients, severe respiratory patients, we'll be like, if this gets to the point where we have to put a breathing tube down your throat to help you breathe, do you want that? And they're alert and oriented times 4 and they say no, then that is a implied verbal consent, not implied. It is a consent saying, no, don't do it to me.
Do you get like your phone out and videotape that? Like,
No, but you have, that's why you have 2 partners, right? You have 2 partners, so we have the ethical approach, right? So like they're assuming that we're not doing it for a reason. We document, patient stated, I did not want this done. And that's one of the things that we ask early on. It's like, respiratory distress people, it's like, have you ever had a tube put in your throat? Yes or no? And if you were to stop breathing, do you want that done? Do you want us to attempt to resuscitate you? People will say no, right? And we're like, whew, okay, all right, so we've got our witness here, right? So now we show up at the hospital, right? And now we're like, yeah, this person's struggling, they're getting ready to intubate this person, right? Because they haven't had that verbal conversation with the person. So what do we have to do now?
Advocate
on that.
to tell them.
Okay, hey, we had this conversation, the person who specifically said they do not want this person, they do not want to be intubated. Okay, so now they're just taking the word of us. So you see where it's like, so our word is pretty, it's an ethical binding type of a thing where it's just like, okay, so that's why having your partner be like, I know you're driving, hey, could you say that a little louder? You do not want to be intubated, right? Hey, did you hear that? They don't want to be intubated. Okay, cool, right? So then that gives you that second person to bounce it off of.
Yeah. So my mom, like, she won't take blood, so she carries like a card that she's filled out and everything, keeps in her wallet at all times. That way if anything ever
I
happens.
thought there was gonna be more to your story. I was like excited, I was just like, oh, yeah, I've had one of these patients, right?
But no, she just has the card so that way if anything happens, they know for sure that she's the one that does.
Yeah, so there are people out there. So I had a patient that was involved in a motorcycle ATV accident, right? Went off in a blow. This person was probably 350 pounds. Big four-wheel drive quad, right? So they had a lot of mass, right? And they ended up basically tearing the diaphragm partially off of the wall, internal wall, right? This person is like actively bleeding interiorly.
Inside.
Internally.
Yeah, I was thinking interior attack there for a second. So internally he was actively bleeding. Pale, cool, diaphoretic, tacky, blood pressure was falling, and we had like 15-minute transport time, right? And he throws that whole thing at me. He's like, I do not want blood. Do not give me blood. Oh, thank you.
Morning, Sarah.
Ah, okay, thank you.
Bye, Sarah.
And so, yeah, he's like, I do not want IVs, I do not want blood, I do not want anything. And I'm just like, pale, cool, diaphoretic, tacky, and now this big dude is at a systolic of 80. I'm like, oh, okay. So we go down okay, you realize we may not make it to the hospital. You may die from this. And he's like, yep. He's like, that is my wishes. He goes, do not give me IVs and do not give me blood. I'm like, okay. All right.
Mask pants?
We don't, it's gone, right? So
But
what
it
do
doesn't matter.
do?
You
Like,
can't. You can't go to the hospital. They can't do anything either.
yeah, so I'm all by myself. All by myself in the back.
Do you ask for an intercept, ask people back there with you for the witness fees?
No, so it's my partner's there. He can hear the whole conversation. Because I'm going, dude, like I'm saying that you're going to die. I'm giving this dude the "you're going to die" speech, and he's like, I don't care. He's like, I'm ready. He's like, I've prepared myself for this. I'm like, dude, you're like 50. I'm just like, there's a long ways to go here, potential. Like, I'm thinking like, I'm trying every card in the book, right? But it was his wishes. So we get to the ER. He makes it to the ER. I was like, whew. I was one of those calls where you just torrential downpour sweat, like Josh is teching the whole time, right? You're soaked, right? And so, like I was just, because the fact that you're just like, you're trying to do everything, we don't use Trendelenburg, but I'm using Trendelenburg because that's all I got.
Jeez.
That was his death song.
Wow. Dying right then and there.
That was it.
So the ER doc comes and he does the same thing, right? He goes down the same spiel all over again, right? They finally get him to consent to IVs only, but no blood. He ends up consenting to have a surgery, but still no blood. So how long do you think it takes you to recover from a surgery when you're bleeding out internally with no blood? How long does it take your body to reproduce your red blood cells and everything?
Couple months.
Couple
Right?
days, 60
Did they put him in a
So it takes, say you lose 2 liters of blood into your belly. How many people give blood? Right? How long until those red blood cells in that blood has reproduced itself?
They usually
Couple days.
can't redonate for another 6 months.
Okay?
6
So
weeks. Sorry,
basically
6 weeks.
26
Sorry, not 6 months. 6
Okay.
weeks.
So we're gonna say roughly a month. Okay? So roughly a month it'll take that person to recover. Right? So he was in the ICU for 3 weeks just because of the fact that his red blood cells weren't recovering. Unhealthy individual, took him longer to reproduce, right? But did he survive? Why did he survive? Yes. The answer is yes, he survived. Right? But why did he survive?
Because he got IV and surgery.
Because he got the IVs and he got the surgery, right? He never received the blood, which was his biggest concern, right? That was an absolute no. He was taking that one all the way to the grave. There was no way he was getting blood. The dude needed blood, right? But the recovery took 5 times as long because of the fact that he refused it. But there are some people that, based on their religious beliefs, that's just what they want. And there's not gonna be no swaying them, and it's gonna be, in your mind, you're thinking, dude, I can fix you. Like, this is an easy fix, like, this is easy, but based on your beliefs and stuff, it's like, you're handcuffing me here, I can't do anything with it. And so this is where you go back and forth, and you're just like, okay, I'm gonna do what I can with the options that you're giving me, right? So this is like starting to take away part of your tools now. It's like, oh, hey, congratulations, we're on scenario, and I'm gonna take your monitor away. It's like, oh, I think maybe I'll start doing that to you guys, just randomly start taking your equipment away from you and be like,
That's okay, we forget shit.
oh, all right. Yeah,
If it's not there, we want you to know to use
You know,
it.
if it's not there, it's not there, right? Can't make it up, right?
I didn't.
But
Let's
if
see.
it's a parent who's like, what is it, not Scientologist, Church of Science?
Whoa.
The ones who don't believe
Christian
in
Science, yeah.
Christian Science. And it's about their child, and they're throwing a fit about, don't touch my kid. What do? Call like?
Yeah, PD.
Yeah, and you're like, and then you just do whatever you need to.
Yeah. And so basically, like, you're getting, everything's gonna become a judgment call at that point, right? So you will never be faulted for trying to save somebody's life when it comes right down to it, right? Like, when there's legal issues like that, and it's like, hey, I'm saying this, but you're saying that, it's like, until there's an official legal police officer that says, yeah, don't do this, it's like, are you gonna just sit there and not help the kid? Like, who knows, like, what, like, you just don't know, kind of situational, like, how that situation
Does
is
that
gonna
parent
play out.
have custody, do they have?
Yeah, like there's so many unknown factors to go with what mom and dad's saying versus a dying kid right there. It's like, hey, well, we have to do this. When the cops show up, we can figure things out from there, right? They're gonna be really pissed at you, right? But let's say that this isn't even like somebody that has custody, has no ability to make medical decisions for this person, but yeah, you're taking their word for it, and you did nothing, right? So you err on the side of, hey, I'm gonna do what I can until and this is an obvious Code 3 police, because you got issues, right? You got major issues that you gotta get ironed out, you gotta get them ironed out quickly.
One of my first questions to you is, well, then who called us?
Right.
Why are we in the first place?
And so a lot of times, parents aren't gonna be the callers on these types of situations. It's gonna be grandma, grandpa, a neighbor, somebody that's concerned for something. Because if that is the belief of the mom or dad, then they don't want you there, because they know that this is it's gonna cause conflict, right? And so it's somebody else, a concerned citizen, somebody else sticking their nose into it that's gonna be the caller.
How's that come into consideration for suicide? Like, obviously, somebody tried to commit suicide because they didn't want help, but then we didn't get a verbal from them, and so because they're unresponsive, they're implied consent. But what if they had a injury that is slowly deteriorating, and they have enough A&O to say we don't want any
Dude, I got an
association?
even better one. Scenario, okay? So, you get dispatched for a 60, I'm just gonna run this scenario through you guys, all right? Scenario time. Be ready to catch the football. Ready? Yeah, and it's coming. So, here's the other thing. If you drop the ball, you gotta fire off 3 questions before I can get over there and pick up the ball. Oh, now that the pressure's on, they're like, wait, let's get some clarity real quick.
Can I stand in the back of the room?
It'd have to be
Okay,
good
so
questions.
we obviously can't like associate someone who has DNR, right?
Yeah.
Then how come someone who is like dying in front of us and says like they don't want blood or whatever, they want to be intubated, how come we don't have to have paperwork?
Because they are verbally giving you the consent or the refusal
Okay.
right then and there.
So,
Because the DNR is there unconscious when you get there.
Exactly. That's where it's just like, don't do anything, grandma doesn't want anything done, they're unconscious, unresponsive already,
Yeah.
and that's why they fill out the DNR, is because they don't want to
They
get to
fall
that
under
point.
implied consent.
Yep, so it's not implied, it's verbal consent, right? So
Well,
they-
when they're unresponsive, it's implied.
Yes, it's
but then
implied
they have the
consent
written.
until they produce the paperwork.
so then to the extreme.
I
So
love
someone
extremes.
Says, if I die, I don't want you to resuscitate me, but that's all they have, and then they die. do you not resuscitate them, just like they said?
I got
It's
Like
the
a
same
verbal
thing.
commitment?
Yeah,
That's
verbal,
what I said.
like,
They just
like a
told you.
DNR, like
They
a
just-
DNR, but they just told you, but they have no DNR.
We just,
Yeah, they were just talking to you though.
Yes, they said, do not do anything to me.
Yeah, you
Verbal
don't do
consent.
anything. It's a verbal refusal.
Wow, that would suck.
My brother had a DNR and wanted it fulfilled, and before the medics
you
got
can't do
there,
anything.
quote unquote,
That
he
sucks.
told his mom,
They wanna
I don't
die,
wanna
it's
die. Medics didn't hear it. Mom tells medics, he said he doesn't wanna die. DNR is right here. She said, he said, sort of thing.
Oh,
Yeah, it was a shit show.
that's a rough one.
Yeah. And then, my brother's a fucking ass with this right there. He didn't wanna be, but then when he was in the ICU and he came out of ICU, he then told the doc, I now wanna live. So that DNR basically just went right then and
Yeah.
there, but it put the medics in a horrible situation.
Yeah.
Because they had in-hand DNR, and then word of mom saying that he did not
So
want
they
to die.
broke the law.
Yeah. Well, how about like you respond on a coworker's family member, right? Like, you don't wanna be that person to tell your coworkers like, hey, sorry, your mom, dad, brother, wife, husband passed away, but yet there's DNR paperwork there, right? So it's like, dude, maybe we could have helped the person out and resuscitated them, but we couldn't because our hands were tied. And so it's just like you have that kind of an awkward situation as well. And so there are those super gray areas where you're just like, son of a, like, what do you do, right? So we always err. So if they say, hey, I don't want anything done, you start BLS. We have different resources. We have the DNR database for OHSU that we can call. If they say, hey, we got a DNR, we can't find it anywhere. We have an OHSU database, we can call and be like, hey, we've got name, date of birth, hey, this person, do they have an active DNR? Every DNR that gets filled out that's official is in this database. Super slick, right? So like, BLS has started, somebody's immediately on the phone trying to get a hold of that, right? Because you don't want to do something if somebody doesn't want to be resuscitated, right? You don't want to go against somebody's wishes. They've prepared themselves to the point where they're ready, right? And so you just don't want to be in that. Then you're gonna be the times where they're like, hey, they're DNR, we can't find any of the paperwork. It's like, oh, okay, and they're like, you call OHSU, and they're like, yeah, we have nothing on file. It's like, oh, son, but now what? What do you do?
Work it.
So you start it, right? So you start BLS stuff, right? And everybody there is saying, hey, I don't want, this person didn't want anything done, so we call a doctor, right? Be like, hey, we started our BLS, right? Because truly that's what people need is at a bare minimum, right? Call the doctor and be like, hey, this is the presentation that we're getting, this is what it looks like. What do you think? What should we do? Like we're throwing out our, hey, help us out here, help us make a decision, pass the buck to the doc, and then be like, hey, yeah, if they say, yeah, run a couple rounds, it's like, okay, hey, so we call our doctor, they said that we have to do this. What's the family gonna say if they are saying this person didn't want anything done?
They're gonna be upset.
They're gonna be pissed at you. They're like, so-and-so didn't want this, and now it turns into a very emotional, even more emotional than it was before. Now everything's getting, yeah. So it's just, there's no great situation, there's no win-win situation for any of that. And so it's just, you're gonna be put in those situations where you're gonna have to make some of those decisions. Yes, James.
So, all of that with implied or even verbal consent, the question comes, like Mark was saying, suicide.
Oh,
And I
freeze,
really wanna
freeze,
talk about that.
freeze. Don't, guess what, we're gonna talk about it right now. Okay, scenario.
Oh, I have one other one though, DNR. The guy had DNR
You dropped it,
tattooed on
3
his
questions.
chest,
Go.
but no paperwork. Like, they couldn't provide any paperwork. 3 paramedics are standing over this guy. He has DNR tattooed across his chest.
That doesn't mean
Dude, that's just a baller.
That doesn't
Like-
mean anything, yeah. So,
he
Get your
would know
horse
this guy was
form
actually
ready.
really old and the tattoo was fairly new.
doesn't matter, that's nothing.
I mean, was
Apparently,
it cute? Was it
the
gothic
3
writing or what are
paramedics
we
that were
talking?
standing over him decided not to resuscitate.
Yeah, so obviously there's gonna be extenuating circumstances that like you don't have the whole picture, but like somebody with a tattoo that says DNR, it's like maybe that's his initials. Like you can't say that that's do not resuscitate me, right? So I had my neighbor growing up. He is a biker dude, rode motorcycles for life. He's like, dude, if you ever pick me up off the street, he's like, just suffocate me with the pillow. He's like, I do not want to be resuscitated. I'm like, okay, for starters, I can't do that. I'm like, and then other than that, you need to put a little card in your wallet that says something along those lines that you don't want to be resuscitated.
Suffocate.
Yeah. I'm like, you want to be suffocated with a pillow. I'm like, I'm not gonna do it. He's
The
like,
doctor just
yeah,
signed
he's
it
like,
off.
hey, just bring the shovel, scoop me up into the ditch, and just leave me there. I'm like, no, dude, it doesn't work like that, right? Okay, so
In the
suicide.
biker
Let's talk
room.
suicide. So here we go. Dispatched to a let's see, I want to say 75-year-old male. Diminished LOC. Assist PD. Okay. 75-year-old male, history of dementia, a little bit of Alzheimer's, and just overall failing health. Right. Wife goes for a walk. Walks the dog with the neighbor. Comes back and finds the husband in the bathtub. Okay? What do you want to know?
Can you paint more of a picture in the bathtub?
Dude,
Oh,
three, let's go!
questions.
Well, when was the last time you saw him?
10 minutes ago. Hurry up before I get there.
Does he have any history of this?
No.
He's already,
Hurry up. Dude! Come on!
he's already smiling.
Is he responsive to?
Oh, he is responsive to pain.
CBG, pupils, can I only do one?
You just did two.
Okay, I just asked for forgiveness.
So you want CBT and pupils. Do you want to know what it looks like?
Yes.
Anybody, like, before you like get in there and start touching and
That's a
feeling
good
it?
Yeah.
idea. Is he breathing on his own?
Like, how about like a, hey, as I approach, what
Can we
what's
have,
my scene
like, a
size up,
scene-
right?
We come at him with the glucose.
Is my scene,
Safe.
is there blood in the bathtub?
There's blood in the bathtub, yes.
Did he shoot himself?
No.
I wish I probably would've
What you
seen
see is you see a giant butcher knife shoved in his abdomen.
Awesome.
Probably not.
Every breath he takes, the knife goes, and this is what it sounds like as he's breathing. Okay? He is conscious and talking to you.
Does he have a DNR?
He does not. Oh my god. Dude, you gotta hurry up.
Is the bleeding control the pressure?
No, he's got a giant knife in his belly.
Shove it in.
Let's go.
Finish him off.
Gosh, I gotta go.
Out of the bathtub?
Not yet. There's blood everywhere.
So why do we want?
He is fighting you and says, don't help me, I want to die.
Can we get a name for it so we can adopt him?
Oh yeah, his name's Chris. Oh, bro, you gotta hurry up. Three of them. You got hurry up. Three. Blood pressure is 80/30. Go. Two more. I mean, no big deal, but he's like literally dying right in front of you.
Let's go.
But he ask me questions. Here we go. Leave me alone.
Well, he doesn't have DNR, so we're gonna treat.
Leave me
him.
alone.
He's going.
Yeah, he's still in the bathtub.
I
Let's
said get him out of the bathtub.
You can't get him out of the bathtub yet. There's blood everywhere.
What is that
So?
We
stopping
can't get a
you?
old man out of the bathtub?
No!
Does he have bilateral?
This dude
lung?
is like Cody size, and it's you in a bathtub, and he's got a knife in
Hey, what
his.
does that mean?
Wash the blood in the shower.
Lung sounds.
What are you trying to say about
So
that?
he has diminished lung sounds bilateral. On the bathtub wall, it says "Let me die" in blood. I kid you not. This is a real call. I kid you not.
He's dementia though.
PD here. I mean,
Oh yeah, they're standing there.
Okay, great. I'm there.
So when you walk through the door,
Yeah.
PD's going, he's in there. Right? They're going the opposite direction, and even like when you have veteran people, crew members, that like you walk in the door. Remember I talked about being that guy or gal that walks through the door and they're just like, oh, thank God you're here, kind of thing. So like I got an engineer that's like 30 plus years of experience, and he's white as a sheet. And I'm just like, hey buddy, what's up? And he's just like, huh, you're gonna need to go in there. I was like, oh, okay, like we have no idea what we're there for. Right? And so I'm teching, so I come around the corner, I do one of these, I'm like, oh. I'm like, what do we got? Oh. I'm like, because it's like pure like horror movie, like leave me alone, like let me die, written in blood on this white thing. And like he's sitting in like this much blood, like just blood everywhere, and he's butt naked too. So it makes it a little harder to get him out as well. All right, where'd that ball go?
Wait, can I say something else?
Yes, go.
What's his normal mentation? Like, is it?
He's able to converse and talk, and
Okay.
like his Alzheimer's and dementia was a new diagnosis, and so he was a little upset with the diagnosis, and he's just like, screw this, this is it, I'm done.
Clean him off.
have to wash the blood off.
Shower, dilute, should we just?
Dilution.
Yeah.
Can you hold the knife stable or stabilize the knife?
No, because every time you go for the knife,
Yeah.
he thrashes around, and then blood goes out around it. What else you got? Is that it?
Talk to the wife and see if we can, I don't know.
Figure out.
Sir, do you have any allergies?
Yeah, I was waiting for that. No, don't talk to me. I don't want to be a paramedic. I don't want to be a paramedic. What do you got?
Oh, 6 questions now.
What about any medications or anything like that for like blood thinners?
No. I'll hand it to you. What do you got? Yeah, you gotta have some sort of question you want to ask this person that's dying in front of you instantaneously. This is
The CBG?
I'm sure that's an
Can we get it off any of that blood?
issue. Just stick it in the mouth.
Can we just, sir, we're gonna have to get a finger poke.
So, I would say that's a trauma alert.
oh good. Yes. Trauma alert based on what criteria?
Penetrating wound to the abdomen.
So you said his mentation, he has the right to say he doesn't want treatment, right?
No.
Or are you saying he doesn't?
He's altered.
That's
So
the
he's-
question.
So he's not altered.
He's
I'm
not
gonna say
altered.
He's oriented enough.
To,
Alert and
to
oriented
make his
times
own
four.
to make his own decisions.
Right.
Did you say you had no pulse?
But he can make his own decisions.
No, he's got a
No
pulse, he's
pulse,
talking
yeah.
to you.
Yeah.
Has anybody
He is
between
not
the
able
wife
to make
and
his own
paramedics are
decision
talking
because
to
he
us,
has to
convincing him to receive
Oh,
care?
yeah, I'm talking to him right now.
He's not altered.
What are you saying?
But.
I'm saying, dude, like, we gotta get you to the hospital because you're dying.
Has he voiced this to his wife prior?
No, wife had no idea this was coming. Like, it was a week ago onset of this Alzheimer's and stuff. He was very upset, very depressed over the diagnosis.
Is he on any new medications?
No.
So what's his past medical history that we have to be concerned about?
Nothing, other than Alzheimer's dementia.
Respiratory rate?
8.
How's the airway?
Airway is fine. He's making that weird kind of gurgling noise. Kind of just the
But you said lung sounds were
diminished,
absent?
diminished bilateral, not
So-
They were dancing
Nope.
around with her numbers.
How were you able to get lung sounds?
So
on?
does this guy have the ability to refuse care?
Yes.
Yeah.
And you have no.
Okay, all in favor of saying he has the right to refuse care, raise your hand.
Ish. Half up. I have a question. I have a question.
Okay, ask your question.
If you commit suicide, does that mean you have the right? Do you have the right to commit suicide?
Then why do we
without?
have in our protocols
You do
ketamine
not.
at
So no. He,
pharmacies?
okay.
So, this person does not have the right to refuse care, because at what point does
Good
he
mental state.
establish that he is committing a crime? Is suicide a crime?
Yes.
Yes,
Yes.
it is.
I did not know that.
So suicide's a crime, and therefore the attempt to commit suicide, the police are able to put a police hold on him until they are able to. So they put a police hold on him, takes all his rights away. You have the ability to treat. So then we go into our full treatment of this person. Okay. So, which was a new one for me. Like, I didn't even know what was going on, right? I'm just like, I don't know what to do. I'm in, and then I'm standing out, and then I'm in again, because it's just like this guy's screaming at me every time I come through the door.
I was gonna say, how'd you get lung sounds on him? If
Oh yeah.
if he
To
doesn't
check
want-
my lungs, but
you can
don't
check
touch-
my lung sounds.
So
But
the
don't-
lung sounds I was able to get later.
Yeah.
And since you guys were asking the question, I was giving you.
How'd you guys, did you guys like pin, like, how'd you get him out?
So
So how do we get him out of the bathtub? A naked
So-
dude covered in blood and a giant knife in his chest.
chemical restraint.
Yeah, you use chemical restraint.
No, we didn't.
What?
No. What we did was just let him bleed out a little bit longer, and his next thing you know, he's asleep, and then it was like, oh, hey.
Here we go.
No. So as soon as the cops got involved and says, hey, sir, I'm sorry to tell you that your rights have been revoked and you are under police hold, he was kind of like, oh, so I have to go? And we're like, yeah, you have to go. And all of a sudden, it immediately became okay.
I'm not dying. I might as well save my life.
Yeah, it's like just this complete flip of like behavior. We're just like, because I was thinking, okay, chemical restraint, we gotta like get something underneath them, right? Like, how are we gonna do this with this guy? Because like he's one of those guys that basically could grab a wad of blood and just start flinging it, and just a disaster of a mess. It's one of those ones where you're like,
Out of the bathtub?
what's that?
Did he like get?
No, of course not, because he was still not happy with us going, so what did we have to do?
Everything.
We used a sheet, and got a sheet underneath him, and then kind of lifted and drug him, blood everywhere with this giant knife in his abdomen, right? So what are we doing the whole time we're moving this guy?
Holding a knife.
Keeping your mouth
So-
closed?
Right, so glasses, mouth closed, eye protection, right? So with this knife sitting here like this, covered in blood, how well do you think it's gonna be to secure this thing?
Not easy.
We didn't want to secure it because it was moving.
Ah, right. So we actually didn't do a thing because this thing was so buried. It was buried all the way to the hub, right? And we're like, well, it's not going anywhere. The only time it moves is when he breathes, right? So he breathes, it moves, and we're like, huh, okay. So what we did, we just scooped them up and we're like, okay, let's try and keep them as flat as possible as we're doing the move, because what we didn't want to do is we didn't want to do any of this, right? We don't want any hunching up of the person. And so we tried to keep them as flat as possible, basically brought them straight out onto the ground, and then we kind of drug them down the hall because it was like this super narrow hallway.
Always is.
And so that's what right there is like. So we had this like awkward like blood trail behind us because I mean there was so much blood. It was a full.
Can you imagine being the person
Blood
hired,
more.
like, to clean that?
Ponchos on?
We did not have ponchos, so that's where it's like I was just doing this whole hike up your boots thing kind of thing, and it's like so like sometimes I wear short sleeve shirts, sometimes I wear long sleeve shirts, sometimes I have my coat on. It's like I like to stay bundled up with you know hoodies and stuff, right? Like I'm always like that, and it's like as soon as I saw that, I was like off goes the sweatshirt. I'm like okay, let's do this because I knew I was gonna end up with blood top to bottom, right? So you go out of service afterward because you're just completely covered. It's on your boots, it's on your pants, it's everywhere, right? There's just no getting away from it.
Do you like just go like shower and change and go back on duty, or are you done?
I don't know. Like, I got a little blood in myself. I'm gonna go home.
Well, like, I don't know if they called in like if that was like or.
No, dude, we're gonna go right on a call, on another call right afterwards. You're gonna be like, oh, I hope we got all the blood cleaned up for Grandma getting on the gurney, right? And so, like, yeah, we don't. I mean, obviously, you can go out of service long enough to try and get as much of that blood cleaned up, but like,
Why do like really,
you're still running calls.
really stressful calls? They'll like call in like a backup.
Yeah, that's not a stressful call. Like stressful calls are like pediatric calls, like kid calls, family calls, stuff like that. This is just one of those crazy calls,
But
right?
that was not a stressful call?
No, that's why we became a paramedic.
So you said it was buried. Was there any inclination you could see how big the knife was? Like
Not until they pulled it out. Not until they pulled it. Well, actually,
Was it
we
like,
saw-
my question is like sticking all the way
Steak
through?
knife.
or
no, it was
like,
not sticking out his back.
Okay.
Steak knife.
No, it's just so the blade was about that long.
Okay.
Okay, and it was at an angle, so it was angled down, which was
That's another
because
question. Like,
he
what-
went like this, right? I mean, just the nerve to be able to go. I was just like,
Below the sternum.
yes, yeah.
Like right.
I mean,
in
because
the-
it was basically right at,
Diaphragm.
like, just think of like when we do our pericardial centesis, just the opposite, right? So we would go this way,
So
he
you probably
went
didn't
that
even hit
way.
a lung.
Right, no.
He did his
And so that's where
diaphragm.
basically, so
Probably
why do you think I had diminished lung sounds?
You couldn't, like the diaphragm, you couldn't.
Because the blood, right? So you got blood down here that's slowly filling that cavity, it's slowly diminishing the lower lobes, right? Is it in the lung fields? No, it's just you're not getting good volume exchange because you're getting a little bit of pressure posterior or anterior.
He cut his diaphragm, or was diaphragm intact?
So diaphragm was totally intact, but he did lacerate some arteries. He got a couple arteries, a couple of veins. Long story short, anything you guys want to do on the way to the hospital, by the way?
2 large bore IVs.
Can we do everything now?
Yeah, now so you got him. You mopped the floor with his blood. You made it to the ambulance. The rest of that crew disappeared because they don't want to be a writer on this one because this is a crazy call.
I had a question back about the suicide stuff.
Jeez, we're back there again.
I've been standing back here for a while. Is the suicide, is it essentially we can't do it if they voice it, or is it they made the attempt?
They made the attempt and were unsuccessful.
So even if it's like,
Because it's a crime.
Yes.
okay, so it's not a verbal thing,
Correct.
it's an actual.
It's an act.
action.
It's the act of performing it, which is what caused.
Takes away.
Yep, which is exactly it. Because like
If you
the
talk
dude's
about
yelling
just
at
a
you,
side
screaming
comment.
at you, don't do it, don't help me, don't help me. He writes it out, and I'm just like, and she's
Is that
pretty.
clinically though, if they like perform the act, it means they're like mentally not?
Right, and that's what takes, yeah, so that's what takes it away,
It really isn't
their
able
ability
to-
away to make the decision, right? But like, as a paramedic, you're just like, huh, okay, we talked about this, like, this is a consent, he's saying no, he's writing no, what do I do? Like, I had no idea until the cop walked in, because I was like, I did one of these things, I'm just like, hey, where's everybody at? Like, I'm the only one in the bathroom now, everybody else is gone. So I just,
The cops were there
Where's your
first.
partner?
so I did one of these, I'm just like, hey,
Yeah, because they're calling on suicides.
so what's the deal? Like, what are the
Should've called
rights here?
Cahoots.
Cahoots? I mean, yeah, Cahoots would have been perfect. A
They
little
would've been on
emotional counseling for this guy, right? But sorry, they're unavailable. Sorry, never
Always.
available.
Never available.
Never available, ever. Ever. Like, I call them on almost every call.
You're trying to interpret to them.
There's a reason why they're never available, is because Engine 2 is using them instead of allowing Tower 2 to use them, right? But, so yeah, so it was one of those things, it's like, dude, I had never been in a situation where the dude's screaming at me to let him die, and then now the cop's going, yeah, no, his rights are gone. He committed a crime, putting him on a police hold, boom. I'm like, so does he get handcuffed? I mean, you start wondering, like, there's all these extra questions.
Pulled the knife out.
Right, so that's what I'm thinking, I'm just like, okay, so that's what we did, we had to soft restrain him once we get him in there, I'm just like, so I don't want him reaching and then coming after me, I'm like, I know he's like 75 years old, but he could probably take me, right? I mean, I'm just like, this is a scary situation, there's a giant knife in this guy's belly. Yes?
So, if someone has the intent to commit suicide, but they haven't attempted it yet, is there still that same type of hold?
Yep, so we go on calls where we specifically ask the question, are you considering harming yourself? Were you intentionally, did you intentionally take the medications in an attempt to hurt yourself? If they say yes at all to any of those, boom, they have to go, we can't leave them, right?
If they say no, and then they say, I don't want you to do anything about it.
Right, then it's not so I'm not gonna tell you how to answer questions, but if you're put in that situation, yeah, so it basically makes it so they're safe, right? They're safe for themselves. Anytime they're a danger to themselves, which is when they say yes. So some of the people that we take on a frequent basis, we got one dude that drives me bonkers. We go on him every day, right? We show up and he's figured out, he's like, because he always has anxiety, he's like, I was thinking about jumping out in front of the bus today. It's like, dude, you know that gets you a ride every time, right? So we went from having chest pain every time, where we say, no, you're not going, to, yeah, I'm gonna step out in front of a bus. What does that do?
Gives them a ride with
The
the police.
hospital you go.
Yeah, it takes it out of our hands. Can we leave him and let Cahoots come pick him up?
No.
No, because what happens if we leave and he's in the queue for Cahoots because Cahoots is never available, and then he jumps out in front of the bus? It's our fault, right? We just left somebody.
Medically stable, you have police. Do police ever transport?
They're gonna come.
That's a good one. That's a really good one. I would love it if police would do half the job, just every once in a while. Like, every once in a while we'll get a Lane County Sheriff dude that will be like, oh, I'll take this person. And we'll be like,
Are you
wait
new?
a second,
Are
are
you
you
new?
new? What is this? I don't understand what's going on, right? The cops do very little transportation on that. The new younger cops are getting better at that. Springfield cops are awesome. Love Springfield cops. They'll do anything you ask them to. But Eugene cops, whole different ball game. And so, yeah. All right. So we got the patient in the back of the ambulance.
2 large bore IVs.
2 large bore IVs.
Vitals.
Vitals 60 over 30.
2000s, hang 'em.
Fluids. Are they still managing their own airways?
Still managing their own airway. Yeah. Mentation is starting to drop.
I have a question.
Suction there.
Oh,
No,
question.
I mean, in general, so if we have fluids wide open and they're bleeding internally, do we still want to push the fluids? I asked you this before.
Yeah. What's gonna happen? What are you gonna do with those clots that are trying to form?
You're gonna bust them out.
You can flush them out, right?
And that way we keep it below 80.
Right. So this is where your
Or up to
permissive
80.
hypotension is kind of what we shoot for trauma. We don't want them bleeding out. We don't want to continue to increase the pressure to blow off those clots, right?
But you need to maintain pressure at the same time.
But
Yeah.
we're just going to 80.
So
So
bring what you said, permissive
So we allow some hypotension in certain situations.
Yeah.
Okay? And most of the time it's pediatrics that we do this for. And so the idea is so when somebody starts to become hypotensive, right, the body increases the clotting factors, right, in an attempt to try and prevent blood, right? So what we do with all of our fluid is we open it wide open, because we're like, oh, we gotta get the pressure up, gotta get the pressure up, right? What does that do to the pressure at those clot positions?
It increases
It
it.
increases the pressure, dilutes the blood, and it blows out your clots. So boom, now you're bleeding again, right? So that's why allowing some hypotension in some severe traumatic events is actually something that
Is there like a number, like below 60, you do put?
usually
fluid,
80
or-
is kind of where we go. 80 to 90 is that range where we're kind of shooting for, where we're happy at 90. We're not going to do anything. We're probably going to give 250 cc's, watch it at around the 80 mark, and try and keep it on the higher end of the 80s up to the 90. What you don't want to do is you don't want to have somebody 80 over 40 that's bleeding out and then dump two liters into them, and now they're up to 130 over 40, or 130 over 90, and now you're just blowing everything out.
So this is now a trauma patient with a BP less than 90, can you do TXA?
You could, yeah, you could, right? And so there's all kinds of different things. So back, we still don't carry TXA, which is,
I think do you drink your blood?
no. We have no blood, no TXA.
Can you say it's 1 gram, 1,000 mils? Or
100.
I was gonna say 1,000 seems too
No, I
much.
know, but like why?
Oxytocin, what we did yesterday was 10 units in 100.
All right, anything else you guys want to do on the way to the
And a
hospital?
liter. Yeah.
Yeah. What? Say yeah.
Monitor the airway, that's good too. Is he breathing on his own?
Yeah. We're down to
Get
about
ready to
6.
intubate.
Down to 6 or 7.
Skip the
Anybody want to
RSA.
put oxygen on this guy?
Yeah,
Yes.
non-rebreather, 15 liters a minute. Maybe bag him.
What's his SpO2?
Maybe intubated.
Back
Get
and
ready
get the
to
RSA
intubate.
kit. No.
Why would you intubate?
Because he's gonna start losing his airway.
If you don't get that pressure up, he's gonna
What's the
lose his airway.
SpO2?
He's still talking to you.
Right, just get ready, because he's fading, he's
Right.
losing blood, he's
So,
going
so do we
away.
need to take over this airway right now?
Not yet.
No. No, this is something where we have our stuff ready. If we don't do our job and keep his pressure, or if he's bleeding out, then we're ready to take over the airway, right? What we're not gonna let happen is we're not gonna get caught behind, right? We're gonna be prepared and thinking, this guy's probably gonna die, so let's get this stuff ready, right? So we got all of our equipment ready, set to go, right? Okay, so they go to the hospital, they have conversations with family members in the ER, the surgeon's there, surgeon walks in, he does one of these like, oh, he's like, that's a good one.
You should have seen that scene.
I was like, dude, you'll not believe it. I was like, so there we were, we walked in, and he's like, it's crazy. He's like, really? I was just like, yeah, he wrote on the thing, don't help me, let me die. And he's like, in blood? Like first time, like one of the only times that I've actually had the conversation with the surgeon, right? And he's just like, he's super intrigued by this painting of the picture, right? Or the blood painting, I think, right? And so like, he's like, this is quite a case. He's like, I go, yeah, cop said that he's under a police hold. And he's like, yeah, I can see that, a suicide attempt, yeah. He goes, I wonder, well, we're probably gonna need to do surgery. And I'm just like, you gotta pull it out. And he's like, I think what we're gonna do, and so after consulting, the cool thing was the physician advisor was a receiving ER doc at the time, so Dr. Doherty. So Doherty was the ER doc. I'm like, hey, got a crazy case for you, like as we walk through the door. And so of course, the entire ER staff wants to see what's going on, right? Because it was like, I'm like, we have an impaled knife in the abdomen in a suicide attempt. And I was just like, and of course I over-exaggerated the blood loss to make it seem, hey, I want someone there when I walk through the door, please, kind of thing. And so of course everybody was there.
So
right?
how much blood did you say?
I may have said 4 liters of blood. I may have said a lot, right?
They don't really have a
because
whole
what
lot.
happens when I say 4 liters of blood? Boom, everybody's there, right?
But was it mixed in with water too?
No, there was no water in the bathtub, which was
Oh,
interesting.
he was just,
He was like literally sitting in.
He's trying to contain
he was, yeah.
He was trying to keep it
He
from
was-
getting messy,
But
and
you
then we
mopped
took it
it
all the way
down.
down. Right?
Anyways.
So after a long consultation with the family and everybody else, they decided that they were just going to pull the knife out and see what happens. No surgery, no nothing. And so they pulled the knife out and.
They do a X-ray before they pull it out?
Yes,
Oh, okay.
yeah, they did all the X-ray and everything, and there was things that were lacerated and stuff like that, and the family was all local, so all the family came in before they did it all. But they had the sheet up to here, but you have this giant protrusion sticking out. Okay, and so they came in and they did all their goodbyes and everything like that, and then they pulled the knife, and then they just sat there with him in the ER, and they gave him one of the private rooms, and slowly, the person just bled more and more and more, and they made a determination that, all right, that's what they were gonna let happen. So it went from please hold to now the doctors are making decisions medically how to care for people. So you go from, hey, you have to do this, to all of a sudden, okay, we've kind of talked about it, and now we're gonna do this, right? So nothing's ever totally set in stone, and so you have to make adjustments like as you go, like as paperwork shows up, right? Oh, here's your DNR, here's this, here's that. It's like, oh, I have a funny looking advanced directive. It's not the pink form. Now you're having to read through and figure out, I'm like, is this legal? Do we have the right signatures? Have I seen one of these before? Okay, yep, okay, this is a living will, it says this. And I'm just like, so like my dad's a paramedic, right? He's got a living will, says do not resuscitate, yada, yada, yada. I'm like, dude, this does me no good, man. I was just like, why don't you just get a stupid pink form like everybody else? He said, well, I thought it'd be kind of funny when the paramedic showed up to resuscitate. I'm like, that's not very funny at all, dude. I was just like, I'm just gonna get a giant thing that says, hey, I vouched your DNR, it says good.